What motivated us to start conservation through public health was based on the experiences I had working as the first vet for Uganda Wildlife Authority, the first veterinary doctor, where we investigated a skin disease outbreak in the then critically endangered mountain gorillas, which was traced to people living around the park who have very little health care. And that made me realize that you can't protect the gorillas without improving the health of the people who share their habitat with these critically endangered species. And CTPH was founded in 2003, and almost 18 years later, we mainly improved the health of the gorillas by setting up gorilla health monitoring. We also strengthen community-based healthcare and teach community health workers to do conservation work. We work closely with communities around the park, getting them to prevent them poaching and collecting firewood in the forest. And one of the ways that we do it is through our alternative livelihoods program, Gorilla Conservation Coffee, where we work with coffee farmers living around Windy Impenetrable National Park, which is home to 43% of the world's endangered mountain gorillas. And often when I'm going to check on the gorillas, we cross coffee farms, and I came to realize that these coffee farmers were not getting a steady market or a fair price, and we needed to find a way to support them. I have faced many challenges being a woman, but actually when I first started out as the first vet for the Wildlife Authority, they'd never had a vet before, and so they weren't quite sure what a vet is supposed to do, because with wildlife you're supposed to leave them there. If you have a sick animal, it may be the next meal for the lion, so you shouldn't interfere. And so they were trying to understand my role. And so I spent a lot of time explaining that, but in the process, it enabled me to gain a lot of respect. A lot of people respected me because I was the only one who had that expertise in the organization. I know it was a very male-dominated field at the time. Most of my colleagues across the continent were men. There was one woman, female vet in Kenya, Dr. Elizabeth Wambua, but everybody else was male. And so it was a very male-dominated field, but I guess people respected me because I brought a unique expertise to the organization. The kind of advice I'd share with young girls who want to get into conservation is, have a role model and follow them. That's definitely, I was inspired by people like Dr. Jane Goodall and the late Dr. Diane Fossey, who started the primates, but also people like Professor Wangari Maathai. She's very, very dynamic and very strong and got a lot done for the environment. I've been encouraged by many women ahead of me. And also they should follow their dreams and the rest will follow. I would say that African women do bring a very unique perspective and a very important one to the whole conversation about climate change, because I feel that African women suffer most from the effects of climate change. And if they're empowered, they're more likely to mitigate it better. So I feel that women's voices should be heard and their opinions should be taken into account. It's very important to break the bias, to be brave and courageous, to break the bias, to dare to break the bias, because that's the only way things can really improve and how we can have a planet in balance. I'm currently writing a book about my conservation journey as a woman in conservation, and I hope that people get to read it. They'll understand the barriers we've had to overcome, both as a woman in conservation and an African in conservation, and I hope that will encourage people. But for more information, visit our website and follow us on Facebook, Twitter, Instagram. And if people want to get experience, they can come and volunteer with us and do research with us and internships and learn about how we are engaging women in conservation and promoting a One Health approach to conservation and carrying out a lot of work with the wildlife. Some of the things that are needed to break the bias: dream big and be willing to follow your dreams, be willing to challenge the status quo, and be courageous and inspire others. I'm Dr. Gladys Kalema-Zikusoka. Let's break the bias.